Assalomu alaykum aziz hamidlar, o'zbekistonlik matbuot shu jigar seryoz bilan kasallangan shu sababli mana Hindistonga O'zbekiston yordami bilan yetib keldim. Sizlarni akalar, ukalar, yaxshi insonlardek duolari bilan mana O'zbekistonga yetib keldik.
Xo'jayinim 5 yil bu jigar sirroziga chalinganlariga 5 yil bo'ldi. 2 marta og'ir komaga tushganlar. O'sha komada Alloh qaytib berganman. O'zbekistonga doktor Vivek borganda biz televideniya orqali, keyin Xulkari opam orqali tanishdik doktor Vivek bilan. O'sha 3 yil, 4 yil oldin doktor Vivek xo'jayinining holati yaxshi emas. Oxirgi yo'li faqat perisadka qilish kerak.
This case is very close to me because they contacted me around 1.5 years back. So this patient was suffering from both hepatitis B virus and D virus disease, and his liver was almost completely damaged and decompensated. So we recommended him liver transplant at that point of time, around 1.5 years back. Although he was on certain medication, but medication were not very effective to control his symptoms and treat him accordingly. So once I recommended him transplant, so he listened to me, but he requested me that he's short of money, so he wants to do crowdfunding. So I told him that okay, I will help him from my side by reducing the package. So we reduced the package for him to a reasonable package, and rest of the money he collected from the crowdfunding, and it took him 1.5 years to collect all the money, but kind enough he said that I don't want to go to any other hospital or any other doctor. So he waited for 1.5 years for collecting the money and coming back to us. We operated this case in December, around 19th of December, and the case went very well. The procedure was uneventful. We did the surgery. Next day morning we removed the ventilator, and he was up and about in 4 to 5 days time, and without any complications. He's being discharged in about 15 days time from the hospital. So he's so happy that when he met me, he had tears in his eyes, and this was really very heart touching to me as a doctor, because when we see our patients getting healthy, we get very happy.
Oldin gapirib olsin, keyin Hospital Noida Fortisda biz juda katta taassurotlar qoldirdik. Men o'ylaganimdan ham juda ham mehrli, doktorlari shirin suxan, ko'zlari bilan kulib, shirin so'zlari bilan davolashar ekan. O'zbekiston milliy taomlari bilan siylashdi bizni. Rahmat hammalaridan. Alloh rozi bo'lsin.
Doktorlarda hammalariga katta rahmat. Ular ichida Kosa xonim, Liha xonim, sababchi bo'ldi. Doim bizni qo'llasin. Alloh menga o'z jonini bashida qilgan ayolim va ciğerini verdi belki 70%'ni. Bana o da halasını yanca yaşamaya o da geçkin. Bana bir genç var işte. Beni sana.
You can imagine that once a patient has to travel for liver transplant, whole family has to travel for liver transplant because it's a big operation. Donor has to come. So there are 5 to 6 people at one point of time who travel from one country to another country, and the duration of treatment is also very long. It takes about 3 months for the complete process to finish off. From the beginning, from the time they enter the hospital and from the time they go back, it takes about 2.5 to 3 months, and there is a lot of financial stress, mental stress, physical stress on the family to go back. So in this whole process, we have devised some mechanisms in which we make them very comfortable and feel at home. So that's why we say that this is a preferred destination. Fortis Hospital is a preferred destination for patients who travel across the globe to us for liver transplantation.
Bizga O'zbekiston ahliga boshini yerga tekkuncha ta'zim qilaman. Sog' bo'lsin, yaxshi kunlarimizda doim birga bo'lsin. Men doim yig'lab nima qilardim. Kulganimizda, xursandchiligimizda doim birga bo'lsin. Mana masalan, men donorlik qilgan bo'lsam, xo'jayinimga 70% jigarimni bergan bo'lsam, bizda hech qanaqa muammo bo'lgan yo'q, to'siqlar bo'lgan yo'q. Alloh xohladi xo'jayinim yaxshi bo'lishlarini, mana yaxshi bo'ldilar.
Specifically from Uzbekistan, we have treated more than 100 patients who have undergone liver transplant and have gone back, and they are living happy life with their families. Uzbekistan, because it's an endemic area, as I told you, a lot of patients are suffering there. So in future, we are planning to open a center in virology clinic, which is in Tashkent, which is the biggest clinic in the Central Asian region. So, and this is the biggest hospital, virology institute. So we are going to open a pre-transplant and post-transplant care ward for the patients who come from Uzbekistan. So basically the problem is patients actually don't know when to go for transplant, and once they go back after transplants, there is nobody to take care of them. So looking these facts in mind, we are opening a ward in virology clinic in which the government is supporting us to open that ward so that we can help them pre-transplant and post-transplantation.